today we are seeing a patient who's here for an arm lift. And tell me what bothers you.
The crepiness on my arms and also the sagging. Like if I'm like that, that's fine, but driving the car,
Right.
you see it?
Yeah.
But also if I hold my purse, it tends to go like this. If I push down, I can see.
Yeah. And what happened? You had...
Oh, I had liposuction
Right.
in my arms. I needed to have a fat transfer. And so it left my arms over a couple of years. Just even with working out, it's still, it bothers me.
Okay. So thank you for letting us use your experience and your arms to educate others. So there are multiple different types of arm lifts. A lot of patients come to me asking for a short scar arm lift with an incision in the axilla or the armpit. That's a procedure that I really despise and believe that it doesn't work well because it only does this and it doesn't correct for the circumferential laxity of the arm. You see, you have all this looseness this way, and if you try to lift it up this way, it doesn't really work. The other reason it doesn't work is because after a while the patients heal and then they want to start moving their arms up to grab things, and this scar that was placed initially well in the armpit gradually moves down, stretches the skin. They'll end up with a scar here and they lose all the correction that surgery offered. So I don't really like that surgery, and I don't do it for anyone because it doesn't work. Then the second question is, well, what can you do? So we have a good amount of excess skin. This is her muscle, and this is the loose skin that is hanging, and underneath the skin there is some fat. So we have about 2 inches of skin laxity. So for patients who don't have a lot of armpit laxity like our patient today, let me just rotate this, sweetheart. Then we can do an extended arm lift, an incision that kind of starts here and goes very low on the arm. It's not in the antebrachial groove and it's not in the back, which are the 2 type of arm lift incisions. I don't do either of them anymore. I kind of do my own with an incision there. So this incision is placed at the junction between the front and the back of the arm, not on the front nor the back, and through which I can go and remove as much skin as needed. And then some of the skin of the elbow will be removed, and then we'll extend the incision into the armpit and remove a little bit of the armpit skin and elevate this. Unlike weight loss patients, she doesn't need armpit lift. She only needs removal of the upper arm lift. She only needs removal of the upper arm skin, and her armpit is actually at a standard or normal position.